This video contains very graphic images of the human body, inside the human body, and pictures of cancer. If you are disturbed by this topic or disturbed by grotesque looking things, I strongly advise you to please click away from this video. Otherwise, I hope you find it educational and I hope that you enjoy. Thank you. Good evening, everybody, and a very happy Thyroid Thursday. I'm going to be talking about two topics in this video, and I'm going to be very transparent with you guys. Obviously, I just got out of the shower, and I've had a long day, and I was going to wait and make this video later, but I just decided to go ahead and do it. Before you watch this video, I do want to disclaim that I know there's a lot of panic going on now, especially with the coronavirus, and a lot of people are frightened. With these topics that I'm going to discuss in this video, I don't want this to cause panic or fear or give you any reason to believe that just because I'm talking about what I went through, that you have cause to worry. Everybody is different, and I say that a lot in all my videos. We're all very different. We respond to treatment differently. Our bodies respond to treatment differently. The causes for disease for every one of us varies from person to person. So especially now more than ever, I want you to be aware that just because I'm explaining what I went through and what I experienced, it doesn't necessarily mean that this is what you would or are experiencing if you do have thyroid cancer or a similar disease. So with that being said, I am going to explain what it was like first for me when I knew that I had cancer the second time, most importantly. So at this point, I had already had my thyroidectomy. This was winter of 2019, so it was just a little bit over a year ago. And I had not yet been diagnosed with metastatic thyroid cancer, but we were kind of pretty much suspicious that I still had cancer. I felt a lump in my neck right around here, this area right here. I can't feel it anymore, obviously, because that lump isn't there anymore. But you know, we weren't sure. We had to, of course, do the testing before we knew for sure. But I could first feel the lump. So externally, I could feel the lump, and I'm a little anxious now because I feel a couple more now that are new on the right, but we don't know what that is yet, so I'm trying not to freak out. But I remember it just kind of appeared very suddenly. So externally, I could feel like it was soft and smooth all across my neck, but on the very surface, I could feel a tiny lump, and it was very, very hard. So that is when my ENT and other doctors decided that it would be very important for me to have the next testing done, the biopsy, the CT imaging, and things like that. So before actually feeling it internally, I felt it externally. So after feeling it externally, externally, I'd say I'd probably already been diagnosed with cancer and already had my surgery, probably to have my neck dissection scheduled. I believe this was right before Easter when I really started to experience really awful pain. Like, up to this point, this was the most excruciating thing I've ever experienced. And I could not imagine. It's so horrible that I couldn't even wish or want to describe what it felt like. I can say that it's similarly, if you experience neuropathy, which is something that I do have, it is sort of very actually similar to that. It's a very stabbing, burning sensation, but to me, it was like a constant knife through the neck. And at this point, I actually did have to ask my oncologist to prescribe some actual pain medicine because I was already out from my previous surgery and I had already had my thyroid removed. Nobody was expecting that after this healed, I would have any reason for pain meds. But after my biopsy came back positive, I very slowly started to experience this pain. And like I said, it was just like no other pain. People say that when you're in the early stages of cancer, you don't experience pain and you don't generally start to feel the actual internal sensations of your tumors or your cancer until it's more advanced. So this was in my lymph nodes, but before it was detectable, they weren't aware at the time that it was there. So I probably did not experience the pain until it, of course, grew larger and it was really detectable. So I am actually going to insert a photo of one of the lymph nodes that was pulled out of me during my neck dissection. So yeah, as you can see, I was not the most attractive looking thing. But yes, so I had the anxiety already that, I had cancer that still needed to be removed. But having that pain was just an extra horrible burden. I mean, it kept me up at night. I was crying in tears and in pain. And since then, I have experienced pain just as severe, but ironically and thankfully, it's only been mostly because of neuropathy, which is something that I strongly encourage you to look up. I don't want to get into that in this video because that's not what this video is about, but I will say truthfully and honestly, just like after having my thyroidectomy, when they removed that lymph node that was causing the most pain, and there were several that were cancerous. I mean, not a ton. At this point, it was no more than 12, but definitely 6. I only had a few that came back grossly positive at the time, but the one that I know was the most painful is the one that you saw the picture of. I can't exactly explain like what part of the lymph node that is, or I mean, I'm not a scientist, but lymph nodes are these tiny little things that are about the size of your pinky, and that was a huge MFer that was in my neck. So you could imagine it was pressing on nerves. It was just awful. So for me, it really did feel like I was being stabbed. It was like a burning razor blade sort of sensation. And it was horrible. And as soon as I had that surgery, yes, I experienced a terrible several months after my neck dissection, but that pain was gone. So I do want to say, when doctors say that if it's painful, then it isn't cancer, that's so not true. And it's made me so upset when I've heard that, because I am one of the people that did experience pain. And I am one of the people that unfortunately their cancer wasn't caught right away, so it metastasized further. Not only that, it metastasized to where it was actually physically causing me pain, excruciating pain. And it's very, very hard to describe to somebody who's never experienced the sensation, but if you are somebody who's experienced neuropathy or a burn victim, and you know what that dull, stabbing, sharp, tingling razor blade feeling is, you know what I mean. It's absolutely horrible. So moving on to the next topic, and once again, I do want to say, please don't be afraid if this is something you're experiencing. I would strongly advise you to go see your doctor, but you probably don't have cancer unless you've definitely been diagnosed with cancer or thyroid cancer. If you're experiencing this, it could be something extremely and 100% different. So please don't be afraid. This is just what I experienced myself. The next thing I want to talk about is thyroid brain fog. And I know that this is going to be a kind of boring video, and I'm going to keep this very brief, but I want to discuss this because it's been a huge, huge pain in my butt. Like, oh man, am I frustrated. So when you hear people talk about chemo brain or thyroid brain fog, this is actually a real thing. And I have no idea what the neurons in your brain do to cause these occurrences, but I've talked to so many other people with cancer and people who've been under anesthesia, or people who've not even had surgery or cancer, but have experienced thyroid brain fog. And for me, I felt completely alone in this until I knew and talked to some other people who experienced this. For me, what it is a lack of short-term memory. It's so frustrating, and it's happened more so now in the past year since having my second surgery and since actually not having a thyroid than it has before I had my thyroid removed. This is the only thing that I have not mentioned as a negative effect, of not having a thyroid anymore, that I haven't mentioned in my video before about, the downfalls about not having a thyroid. This is actually a really, really annoying one. It's very frustrating. I will be trying to think of, a word that I've known all my life, like the color blue, for instance. I'll be trying to describe something to somebody, and I can't even think of what a color is. I'll be, thinking of one thing and in mid-sentence describing it to a friend or my fiance, and it's so frustrating to me because I can't even remember what I was saying a second ago. I'm not even kidding. Like, literally a second ago, I'll start a sentence and completely forget what I'm saying. It is horrible. And there's been research and studies and things that, possibly direct it to medication. I've done research thinking that because I've been on gabapentin long term, that could be a cause. But my dosages are so small, it's really probably not because of that. And even I took a break from that medicine for a while, and everything that I was on that was 100% not necessary for me to actually take, and it was still there. It did not improve. It could be because of a magnesium deficiency, oxygen not reaching my brain enough, but this is a normal thing. Chemo brain and thyroid brain fog are not the same thing. Me, of course, because I've never been through chemo, but other people who have describe the exact same thing. They will be thinking of a sentence or a word that they've known their entire life, and they cannot for the life of them think of what it is. It is horrible. I used to be a very articulate person. I loved writing essays, having long conversations. I like to motivational speak. I like to, just be one of those people that is a public speaker, and it's what I do for a living. And when I'm trying to teach a class, in the middle of what I'm trying to explain, I will not know the simplest of words. I will try to say something, and it's so frustrating when I can't tell the person I'm trying to tell what I'm trying to say. And it's almost like you're having a language barrier between you and the person. And the struggle is real. I hope that this gets better, and that, if I don't continue to have to go through more surgeries and anesthesia, that over time that I might, be healed from this. But if not, it's okay. There are definitely worse things. But, I just wanted to say that this is part of my life and, part of the journey that I've lived through, and it's a huge pain, and I hate it. But there are definitely worse things to, experience, being a cancer patient or having thyroid problems or anything as a side effect of any disease or treatment that you might have. This just happens to be one, as well as the pain, that's been pretty sucky, and I wanted to explain it. If you've made it to this video, guys, I want to thank you so much. I really, really am trying to get my content out there. I've made so many friends online through Instagram and YouTube who are like me and who have been through what I've been through, but there are so many people who haven't been through what we've been through but will soon, and there's very, very little content out there about this, about metastatic thyroid cancer, thyroid disorders, all sorts of different diseases, brain fog, lots of topics that I'm still yet to discuss that we'll talk about, and I really want people to see these videos. I don't like to harass my viewers to subscribe and to comment, but it really helps. Every like, comment, that I get or subscription that I get, the more people out there can just get the opportunity to see me a little quicker, to hear what I have to say without having to search for half an hour. I don't pop up right away. I haven't been on YouTube long enough. My platform is not large enough yet. If you would like and subscribe or share my video, that would really help me out a lot. And I really appreciate everybody who's been so committed to me and watching my videos and loving me, and my family throughout this entire journey. We don't know where this is going. I'm trying not to be afraid. I have so much this year to be thankful for, and I'm gonna get emotional. So I just want to thank you guys so much for everything that you've done to help me and my family, and just remind me every day to be strong. It is definitely a lifelong journey and something that I'm having to learn to deal with every day, but I'm getting better, and I cannot thank you enough for the love that I've gotten from all of you, and even from those of you who I don't know who just watch me online and follow me on Instagram and love me. I just really appreciate it, guys. So please stay safe. There's a lot going on in the United States and all over the world now, and a lot of people are very afraid. A lot of people are afraid for their health. So now more than ever, I just ask that you try to stay as physically and mentally strong as you possibly can. Thank you so much for watching this video. I'll see you guys next week. Bye.